Welcome to Health Unplugged, brought to you by Lifeway Medical Diagnostic Hub. This is the place where we discuss and dissect important health-related issues that matters to everyone. My name is Amazing Rita, and today on this episode, we'll be talking about Polycystic Ovarian Syndrome, also known as PCOS. I'm not alone in the studio. I'm seated with Dr. Dimba Favor. Hi, Dr. Favor.
Hello.
How you doing?
I'm fine. How are you?
Wonderful to see you again.
I'm happy to see you too.
Okay. On today's episode, we will be discussing on how PCOS affects the woman, the family, the child, and everyone around her. You know, some people see it as feminine madness. Some people see it as women throwing unnecessary tantrum.
Okay.
And some people see it as something that's should I say, like a consequence. You know, it's easy to, it's not easy when women are suffering from PCOS and then they are not married, because you not see people
linking it
to that. Should I say this person go fit born? That kind of
exactly.
Okay, but Dr. Favor, let's get right into the conversation. What is PCOS?
Okay. PCOS, just like you said earlier, Polycystic Ovarian Syndrome, Polycystic Ovary Syndrome, is an endocrine disorder that has a is made up from a number of symptoms. You can also say it's a hormonal disorder. So someone having PCOS would have, you can grade the symptoms into the hormonal part, the genetic part, and then the environmental part. So for the hormonal part, this person would have things that are in line with hyperandrogenism. Androgen is a hormone that is found in women, in females, but in minute quantity. But is more in males. Yes. But then someone having PCOS would have hyperandrogenism. And then this hyperandrogenism will present in the following ways. First of all, the person would have excessive facial hairs. Could have hairs on the chest, on the back. Then there could be hair recession, hairline recession, something like what we call baldness.
Yes.
Exactly. There could also
from here to here.
There could also be acne. So these are the things hyperandrogenism could cause.
Okay.
Yes, so you could see these things in someone with PCOS. Then the environmental part, sometimes person could be obese, like weight gain, yes. And then this obesity, though you won't see insulin resistance, it's not something you see physically, but then the obesity could bring about insulin resistance.
So why is it misunderstood? Why do people see it and then because of social media, we tend to see women that are now trying to be outspoken with facial hairs, hair on their chest, even body hair everywhere. And then even while this person is trying to own up to what's happening to her, you see somebody in the comment section
throwing one or two.
Why do people really misunderstand it?
Anyway, even without the concept of PCOS, I don't know if you've heard about this saying. People will be like, all these women that are hairy, they have facial hairs, they are very wicked.
That's true.
But I don't think it's actually that way, because I've seen women with facial hairs that are very, very kind, very nice. So I don't think that follows. So I don't know, people just have this misunderstanding or misconception about it. Yeah. And then I'm not in their minds. I can't really say the reason why they have that misconception. But then PCOS, I don't think it's something that should bring about such misconception. Yes, it's not like these people created themselves. And it's not like they came into the world and said, I want myself to look this way. So I don't think they should be treated in that manner. Yeah.
Is having facial hair or probably excessive hair the most common symptom of PCOS in women?
Okay, it's part of the symptoms, but not the most common symptom. Like, you can use this term hirsutism to to just classify the excessive facial hairs, chest hairs, you can just call it hirsutism. But then there are other symptoms you can see in someone with PCOS. Yeah, you could see the excessive hair hirsutism, you could see the hair recession, baldness, you could see acne, you could see weight gain. The person is usually overweight. So these are some symptoms. Remember, I told you symptoms are things the patient comes comes with, presents to the doctor with, but then signs are the ones the doctor can elicit.
Okay.
Yes, then some other things. This one is not, you won't call them symptoms because the patient is not presenting with them. Yeah, but then the patient could also have infertility.
Okay.
Yes, then if you check on a scan, you could also see multiple cysts on the ovary. Then some people who have PCOS, another symptom they can come with is the people that are overweight, the weight gain, they could have central fat.
Wow.
Yes, central fat is this, like more adipose tissue around the abdomen, abdominal fat. Exactly. So that's another thing they can come with. And then maybe stretch marks,
Okay.
Yes, these are some things that they could present with.
So having irregular menstruation, does it connect to PCOS?
Yeah, it does. The way it does is this. Like now, someone having PCOS, I told you they could have multiple cysts in the ovary. So a cyst normally is just like a fluid-filled sac. Just imagine it's like a covering filled up with fluid. Normally, what would make someone with PCOS to have irregular period? Because ovulation must occur before someone sees her period.
That's right.
So how does ovulation occur? The ovary will release a mature egg, and then when that egg is matured, that's at the point the luteinizing hormone will get to its peak. So that the release of that mature egg is what causes ovulation. That egg is released either to be fertilized by a sperm, or if it's in a case where it's not fertilized by a sperm, it will be washed out as period. Do you understand?
Yes.
Yeah, so in a case where someone is not ovulating, it's possible that this person would not equally menstruate. Because I told you, this mature egg that is released is either to be fertilized or to be washed away as what we call menstrual period. Exactly. So someone who is not ovulating, because in a case where this mature egg does not get to the mature form, it will form cysts in the ovary. Yes, that's why you see the multiple cysts. So they are not getting matured enough to either be fertilized or released. Exactly. So in that case, this person may not see her period.
But some women who are suffering from PCOS have regular period.
Okay. The reason is this. Some people could have PCOS with mild symptoms.
Okay.
Exactly. It's not everyone that has PCOS that must have the multiple cysts, because there's a criteria used to say this person has PCOS.
Okay.
They call it the Rotterdam's criteria.
Okay.
And that Rotterdam's criteria is made up of 3 things. So someone presenting with 2 or the 3 would be said to have PCOS. So it's possible that this person does not have the multiple cysts, yes, but has the other 2.
Okay.
Exactly. So the Rotterdam criteria, what is it made up of? It's made up of 3 things, like I said. First of all, the presence of anovulation or oligo-ovulation. Anovulation means there is no ovulation, like what I explained earlier. The fact that these eggs are not getting mature enough, this person will not experience ovulation. So the presence of an or oligo-ovulation. So this anovulation or oligo-ovulation is what influences the menstrual flow, the menstruation. Do you understand? Then the second criteria is presence of hyperandrogenism.
Okay.
Yes. And this hyper is just like an English word, high. Yes. So that one you could use either physical assessment
Okay.
or investigation. The physical assessment, what are you looking for? You're looking for the presence of the excessive, maybe facial hairs, chest hairs, hair on the back, the hair recession, the acne. So these are the physical things you're looking for. Then investigation, you want to check the extent of testosterone in this female.
Wow.
Yes, because androgens are converted to testosterone. Exactly. So that one will help you find out if this person has hyperandrogenism. Then the third one is the ultrasound finding of the multiple cysts in the ovum, in the ovary. So that's the third component of the Rotterdam's criteria. So 2 or more exactly gives rise to PCOS. Yes. So someone could have PCOS and still see her normal periods, still experience normal ovulation. Possibly she has the first 2 and then does not have the third. Exactly.
Okay.
Yeah. So that explains it.
And it's mild.
Yeah.
Okay, thank you very much.
You're
You
welcome.
also mentioned about cysts, having multiple cysts.
Yes.
Are there cases where a woman won't have ovarian cyst, but we still have PCOS?
Exactly, that's just like what I explained
Okay,
earlier.
okay.
Yes, it's possible she will have the first 2 and then not have the third criteria, which is the presence of multiple cysts confirmed by an ultrasound scan. Yes, so it's very possible.
Is PCOS hereditary?
Yes, genetics, family history, there are 2 strong risk factors in PCOS. Yes, and then when you talk of hereditary, like first degree relatives. When I say first degree relatives, what do I mean? It means, let me say now, this is Mrs. A.
Yes.
Her mother had PCOS. Her siblings have PCOS. Her mother, her siblings are first degree relatives. So people with positive family history in first degree relatives, they are at high risk of coming down with PCOS. Then genetics as well, like possibly a gene alteration. Yes, these are 2 high risk factors.
With the fact that some women having PCOS suffer from irregular menstruation due to ovulation and eggs not maturing well, can women suffering from PCOS get pregnant naturally?
Yes, it's very possible. How is this possible? Because once you notice, let me say, maybe an adolescent female starts seeing her period, it's a different thing when a female starts seeing her period and then in the first year there are irregularities. That one happens naturally. But then afterwards, let me say she keeps seeing her period consistently and then after a while she starts noticing that there are irregularities. First of all, it's important she sees a doctor. The reason is this, because if she's diagnosed of PCOS, there are management guidelines to PCOS, yes, and then it depends on what she wants to achieve. If it's for fertility, there are things to try out first before. If those trials fail, that is when you now go for maybe IVF or others. Yes, but there are things like there are medications to give, and the targets of these medications are 1, to induce ovulation. Remember I told you when the eggs don't get matured, this person cannot ovulate. Exactly. So there are medications to use to induce ovulation, 1, and then when she's ovulating, she can take in. Exactly. So there are also medications to counteract the hyperandrogenism, the medications to stop the androgen production or increase. Exactly. So there are medications to try out first. So it's very possible for someone with PCOS to take in or conceive naturally. Yeah.
Then there are also some women who opt for IVF due to PCOS. Would you say for those who cannot conceive naturally, is IVF their only option?
I won't really say IVF is their only option. There are other options, just like surrogacy. Surrogacy, you know what surrogacy is, where even if her eggs will not be used, there could be a donor egg and then the sperm of the husband. Exactly, and then it's implanted into someone else to carry the pregnancy. There's also what we call intrauterine insemination. Though that one does not give high success rates. Exactly. But that's where the sperm is implanted into the uterine cavity. So, but like I said, it doesn't give high success rates.
Okay.
So these are some options.
All right.
Yeah.
Oh, interesting. Now, fibroid,
Okay.
like we discussed before,
Okay.
affects fertility.
Yeah.
PCOS affects fertility.
Yeah.
Is there a relation?
Okay, yes, there's a relationship between fibroid and PCOS. And what's the relationship? Here, remember when we discussed fibroid, we said obesity is one of the risk factors. That's the same thing in PCOS because to further increase production of androgen. And remember, hyperandrogenism is one of the things we have in PCOS. So obesity is a risk factor in both. Another thing is this. Estrogen, unopposed estrogen. Remember when we discussed fibroid, we said estrogen is the hormone that powers fibroid. That's the same thing in PCOS. There's unopposed production of estrogen. So you can see estrogen is a hormone that is playing a very, very vital role in both PCOS and fibroid. And then someone having PCOS with unopposed estrogen, the person would have a thickened endometrium. Remember, when the eggs get to maturity and then they are not fertilized, when they are released as menstrual flow. Yes, but in this person who is having PCOS, the eggs are not getting matured enough, so there's no release. Exactly. So the endometrium continues to get thickened because estrogen is at its peak. So this is just like a link between the both of them.
Okay.
Yeah.
Okay. Well, let me say this one.
Okay.
Can one person suffer from fibroid and PCOS?
Yes, it's possible. It's very possible.
Okay. Now you talked about obesity being one of the
Risk factors.
the risk factor.
Yeah.
Can it also be how would I put it, like a symptom? Example, can someone be obese because she has PCOS?
Okay. I think they are interchanged.
Okay.
Obesity or weight gain or being on the big side can be both a symptom and then a cause of PCOS. Yes. Though it is more of a symptom, but they can be intertwined because someone having insulin resistance, I think I would say insulin resistance is just like the main link. Do you understand? Because someone having insulin resistance, the insulin cannot work. Do you understand?
Yeah.
It cannot work. So this person, like, in some way, weight gain is just like interchanged. Exactly, and a symptom. Yeah.
Since PCOS tends to affect fertility, does it affect sexual health, like the woman's libido or sexual drive?
Okay, I would say to an extent it does. Because imagine a woman now, first of all, sex life, libido, they are all connected to the mind.
Yes.
Like it has something to do with psychology.
Yes.
So imagine a woman now who has low self-esteem, secondary to the fact that she's saying, I'm feeling like I have a lot of hairs, I have a lot of facial hairs, chest hairs, hair at the back, acne. First of all, that could make her get depressed.
Yeah.
And then psychologically, she's already down. So it's a way it could affect her psyche and then affect her libido or her sexual life. That's one. Secondly, imagine someone having PCOS and then she has been diagnosed that she won't be able to conceive by herself after the doctor has tried, maybe giving her the medications to induce ovulation, the medications to stop the hyperandrogenism, and then there was no progress. And then she now has to go the other route, maybe do IVF, do intrauterine insemination or surrogacy. You can see she's already feeling like, I've failed in this area.
Yes.
Exactly.
And the fear and everything.
Beautiful. So the fear acts on her mind. And then it affects her whole sexual life, the whole libido. So these are ways PCOS can affect the sexual life. Yeah.
All right. Then how is it diagnosed? What tests can be done for people who want to know if they have PCOS? And how can it be diagnosed in centers, medical centers?
Okay. First of all, to diagnose PCOS is a combination of both your history taking, your physical examination, and then your laboratory investigations. In your history taking, you're trying to find out, have you had episodes of irregular menstruation? Have you had episodes of anovulation where you didn't ovulate? So that's like you try to find out these questions in your history taking. You try to find out the family history. Is there positive history of such in your mom, your siblings? So these are some things you asked in the physical history, in the history taking. Then for physical examination, you want to check if this patient is hirsute, like if she's having hirsutism, the excess facial hairs, the hair recession, the chest hairs, the acne. You want to look out for all those things. You also want to check for the central fat, the striae. Then your investigations, you want to do a hormone assay. What are you looking for in a hormone assay? You want to check if the luteinizing hormone is high. Luteinizing hormone, like I said, insulin resistance, insulin accumulation can cause increase in luteinizing hormone, and then it has its effect on causing it will cause the ovaries to produce more androgen. So you want to check for luteinizing hormone, you want to check for follicle stimulating hormone, you want to check for testosterone, because like I said, androgens are converted to testosterone. Then finally, you would like to do an ultrasound for this patient. The ultrasound will show you the presence of the multiple cysts in the ovary. So this is how to make a diagnosis. And then you also include the Rotterdam's criteria. Generally, when you're done with all those things, you would classify this patient if she has 2 or more of these criteria. So you say she has PCOS.
Okay, Dr. Favor. For women suffering from PCOS, thank God for the enlightenment we're having and understanding it better. But I want to ask, is there a cure for it? Or if you have PCOS, all you have to do is learn to manage it? Or is there a cure, like there's a treatment plan or something, and then you know that you're cured of PCOS?
Okay, I won't really say there's a cure for PCOS. Yes,
I was hoping you will not
it's
say
just usually it's managed symptomatically.
Okay.
Yes, like you just try to manage the symptoms the patient is presenting with. If the patient is presenting with the hirsutism, the excessive hair, you have to work on the androgen factor. If the person's aim for treatment is fertility, you have to do things that would induce ovulation. Yes, so it can't actually be cured. It's just managed symptomatically.
Okay, are there some lifestyle practice that can actually put you at high risk of, apart from obesity, of course, like some lifestyle practice that can put you at risk of PCOS?
Yes. Okay, I would say sedentary lifestyle. Sedentary lifestyle we keep talking about every time. The fact that someone is not active. Exactly. Yes, it can put someone at a risk of PCOS, because someone who is living a sedentary lifestyle, you know, the person tends to just keep consuming without burning out, and by the time the person is done consuming, what will it tilt to? Obesity. So obesity will now connect to PCOS. Then people who take a lot of alcohol and don't eat healthy, yes, there are some things people eat that still tilts them to obesity, like processed foods, excessive sugary foods, diets that are very rich in sugars, all these things, they tilt someone towards getting obese. And then this whole thing, they have a way of interplaying and pushing this person to PCOS.
Okay. For someone suffering from PCOS and fertility is already an issue.
Okay.
Is it safe for the person or the woman to use birth control pills and other birth control method? Like the IUD and the rest. Is this safe?
Birth control method is one of the treatment mechanisms
of PCOS.
Yes, because what does it do? It helps re-regulate the hormonal imbalance this patient is having. So it's actually safe, but not the person administering it to herself on her own. Exactly. She must make sure she's working with her doctor. Beautiful, because it's one of the treatment plans.
Okay.
Yes. Birth control pills or birth control methods, they are one of the treatment plans. They help readjust the hormonal imbalance this woman is experiencing.
Okay, PCOS that are left unmanaged or nothing is done about it, can they lead to something else?
Yes, they can. Like they could cause cardiovascular issues, heart diseases, because just like I said, PCOS has a link with insulin resistance and then obesity. And people who are obese, they are at high risk of having diabetes, especially the type 2 diabetes, because insulin resistance, you know, is like the cause of type 2 diabetes. It's not like insulin is not available. Insulin is available, but then it's not working because of the resistance. So that's like the pathophysiology, the cause of type 2 diabetes. So people who have PCOS, remember I said they have high risk of insulin resistance. So these people, if the PCOS is not managed, they are at risk of coming down with either type 2 diabetes, cardiovascular issues. So that's it.
So are there early signs of PCOS that can be seen in teenage girls?
I won't. Okay, it's possible, because maybe a teenage girl who has passed her first year of menstruation. Remember I told you in the first year, it's possible that there will be irregularities. Yes, it happens. But then afterwards, she notices like, I'm having irregular periods. I'm having an ovulation. You know, there are things to look out for to make you know you're ovulating. She notices that these things are not regular. Maybe she's hirsute, and then all these things, there are things to look out for, and then know that something is actually wrong.
Yes.
Let me go see a doctor. Yeah.
Okay. You talked about someone that has passed through her first year of menstruation.
Yes.
Now, PCOS is not menstrual disorder, right?
No, it's not.
But can it be misunderstood to be it?
Yeah, it can, because there are other things that could cause menstrual disorders apart from PCOS. So that's why I said maybe when a teenage girl notices these things, it's good to see a doctor so that he can make out the difference to know if this is actually from PCOS or from another thing.
Yes.
Other things like even a thyroid disorder, thyroid gland. Yes, a thyroid disorder could cause hormonal imbalance leading to menstrual irregularities. Yes, someone also having premature ovarian failure before the age of 40, the ovaries have stopped functioning properly. That person will also have irregularities with menstruation.
Yeah.
So you see, someone having this could also think is PCOS. That's why it's very important you see your healthcare provider or your doctor. Someone also having something like secondary amenorrhea. Secondary amenorrhea is just a situation where this girl has been seeing her period regularly, but then there's a sudden cessation of the periods for more than 6 months and is not caused by pregnancy. That is what we term secondary amenorrhea. So these are things that could also cause menstrual irregularities. Yeah.
The symptoms of PCOS, do they worsen with age?
Okay, PCOS is just, it happens more with reproductive age. Reproductive age, because at that point, the ovaries are still very, very functional. So once someone is at menopause, the symptoms of PCOS should not worsen. Rather, they should decline. Exactly. Except if PCOS is diagnosed early enough but left untreated, from the time of diagnosis till menopause, the symptoms would worsen because at that point the ovaries are highly functional.
All right. So lastly, before we go, what is one thing or some of the things you feel doctors doctors wish women knew concerning PCOS? Okay,
for this, I would say one thing I wish doctors would maybe advise women or wish women knew concerning PCOS is this: like, early diagnosis is always key. PCOS is not something I would say prevention is better than cure, because you can't prevent it from happening. Exactly. If it was a scenario where it could be prevented from happening, I would just say prevention is better than cure. But for now, it's not something you can prevent.
Yeah,
So
so
early
early
diagnosis is key. Yes, if you notice these abnormalities, is wiser or safer to go see a doctor, so that if it's PCOS, it could be handled on time rather than allowing it to progress. Like I
Yeah.
said, it could progress and then cause further worsen things, make this woman to come down with a type 2 diabetes, cardiovascular issues, could even go as far as causing an endometrial cancer.
Yeah.
Because like I said earlier, someone who has PCOS would have endometrial hypertrophy. From there, endometrial hypertrophy could further transform with time into a CA.
Okay.
Yes.
All right. Thank you so much, Dr. Favor.
You're welcome.
Thank you for the light shed on this topic. So it's not like women are trained on assessing tantrum,
No,
or
they're not.
they just sometimes like maybe a woman suffering from PCOS and she's married, but then maybe her sexual drive is low, and the man will be like, "What is all this now?"
What's wrong with this woman?
Yes, there's actually a reason for this, and what they are feeling is valid, because it's affecting their health, it's affecting their mind, and everything, affecting their whole body. Imagine staying for 2-3 years, and maybe you didn't know it was PCOS, something that you can actually manage with symptoms. You can manage it, and then you are going to all the miracle houses looking for a child. So yeah, thank you for joining us on this very educative episode. And then do not forget to check out our other videos. If you're looking for a place where we can dissect and talk about important health-related issues that matters to everybody, this is the place, because here is Health Unplugged, brought to you by Lifeway Medical Diagnostic Hub. My name is Amazing Rita, and it has been my pleasure to share this studio, this space, and this topic with Dr. Dimma Favor. And then we'll see you in our next video. Bye.
Bye.